ocular surface squamous neoplasia (OSSN). Ocular surface squamous neoplasia encompasses various dysplastic changes affecting conjunctiva, cornea and the limbus. It is a prevalent malignancy affecting conjunctiva globally and highest incidence observed in the tropical regions. It was first documented by von Graffe in 1860. The grading system was introduced by Lee and Hurst, and it is divided into three types: benign dysplasia, pre-invasive OSSN and invasive OSSN, and these are the subtypes which are mentioned. And histopathology remains the gold standard for the diagnosis. And for surgery, no-touch technique introduced by Sealed et al. Is preferred for surgical removal. This technique aims to remove the tumor with clear margin while minimizing the risk of microscopic seeding. Despite this, there is no consensus on optimal margin during the surgery. Coming to case 1, this is a case series of 4 different type of the cases. Coming to case 1, it is a case of 70-year-old female with mass encroaching right eye since 1 year, and on examination there is a papilliform type of the conjunctival lesion which involved around 9 clock hours, and visual acuity was quite good. On impression cytology, there is mild to moderate dysplasia as shown in the picture and highlighted, and this is the post-op picture after the surgery, post-op 1 month picture after the surgery. Pre-operative and post-operative mitomycin cycles were given. Coming to case 2, it is a case of 60-year-old female with redness and mass encroaching in the cornea right eye since 6 months. On slit lamp examination, it appeared as gelatinous type of carcinomatous lesion, and visual acuity is quite good in this case also. And this is the photomicrograph, histopathological photograph of the tumor showing the involvement of full thickness of epithelium, but there is no invasion. And this is the photograph of the patient after having surgery, 1 week post-op photograph. And excision of the mass is done, and it is followed by pre-operative and post-operative cycle was given, 3 post-operative cycles. Coming to case 3, it is a case of 40-year-old male presented with a pterygium-like mass in the left eye since 6 months. Visual acuity was good, and on impression cytology, we saw these cells in the dysplastic, which shows dysplastic changes. The patient was directly taken for the surgery without pre-operative cycle of mitomycin C. Mass excision was performed, and post-operative patient commenced for 4 cycle of topical mitomycin C 0.04% along with mild steroid. Coming to case 4, it is a case of 45-year-old female with a mass in left eye since 5 months. On slit lamp examination, it appears like leukoplakic type of carcinomatous lesion with melanocytic changes. On histopathology, it reveals the severe dysplasia with dysplasia of the squamous cell. The patient was reduced for excision of the mass along with pre and post-operative course of mitomycin C 0.04%, and we also do the cryotherapy along with the mass excision in this case. Coming to discussion, in our case series, the patients were taken between 40 to 70 years. Female predominance was seen, as female also go for outdoor area work and exposed for UVB rays. There is strong association of OSSN with human papilloma virus and HIV, but in this case no patient had HPV and HIV infection. Visual acuity was quite good in all 4 cases as supported by the literature. The lesion was located in interpalpebral area, which was also supported by the literature. Lesions have been described in varying appearance like morphology. There is gelatinous lesion, papilloform lesion and the leukoplakic lesions. Varying degree of dysplasia also seen, but normal polarity and basal layers of cells are often unremarkable. Pre-invasive OSSN have been classified as mild, moderate and severe based on the degree of involvement of the dysplastic epithelium and the layers affected. Treatment of ocular surface squamous neoplasia varies upon the lesion size and severity. Smaller lesion needs less invasive treatment like with complete excision with topical chemotherapy, while the larger invasive lesion also require cryotherapy and radiotherapy sometimes. During surgery or margin beyond the visible area of disease, usually excise and cryotherapy can be used to freeze the remaining cancer cells. Mitomycin C, we give the mitomycin C in all of our
Kindly wind up your case.
Yes. These are the pre-op and post-op pictures of all 4 cases. These are my references. Thank you.
Thank you. On alpha 2B. Mitomycin has become the next choice. Yeah, that's the problem. And secondly, for larger lesions, you would first do chemotherapy, try to do a chemo reduction. That's the protocol. And if it is of the excisable state, then you straight away go in for excision. And cryotherapy should be done in all the cases for the HCS. So you said only for the last case which was done.
Yes, sir. We done for all the cases. Yeah.
Okay.
For pterygium case, we do not.
Right. Thank you.
The other
Next
important
speaker.
thing there, whether